Is 15 minutes the optimal treatment time for red light therapy dosing? According to several interviews with Dr. Hamblin, one of the world's leading researchers on photobiomodulation, he often recommends 15 minutes of treatment time with red light therapy devices.
Yeah, I would suggest maybe 15 minutes a day. Yeah, it's about 15 minutes. Sort of 15 minutes a day is a sort of time relatively active. 20 minutes sometimes, something like that.
Now, I noticed this on a recent interview with the Squint podcast that Dr. Hamblin was recommending 15 minutes for brain health treatments with an LED helmet.
About LED therapy, you can buy a device and you can use it at home. And if you're interested in the brain, you can get LED helmets. There's a lot of them on the market now. They're generally a mixture of red and near-infrared LEDs. You can wear them on your head. I would suggest maybe 15 minutes a day, even twice a day.
So I went back and looked at some of his other interviews if he was also recommending 15 minutes and what he would say about full body red light therapy treatments. So on the Max Lugavere podcast, he also gave a similar answer.
Yeah, I think it's just if people
Interesting.
have busy lives, and it may be easier for them to have something like a Juve panel that they can use for 15 minutes whenever they like.
So what then if people do go out and pick up these panels, is there like a prescription for general health that you might be able to offer in terms of how one, uses these devices?
Yeah, well, it depends on the size of the device. What they say is hang it on the back of the door and stand in front of it. But, I've never done that. I think that's a bit bizarre. So something like a Juve panel is sturdy enough as you can put it on the bed and just lie on it. More light goes into the body if the skin is touching the surface of the panel, for sure, because you don't get diffuse reflection. It's about 15 minutes lying on this panel.
So we see here on the Max Lugavere podcast that dosing full body red light therapy is very straightforward and consistent. You just need a decently powered panel.
Yeah,
that we've already discussed.
It's quite a decent powered device. And the Juve device is actually quite a decent power.
You lay on the panel for 15 minutes. Because, of course, it's also kind of bizarre to be standing a distance away from red light therapy panels, since most of the studies use skin contact to eliminate those reflection losses. And it's particularly compelling if you watch my previous video on 15-minute treatment times. Multiple of the top researchers are preferring 15 minutes of exposure time for red light therapy. And we also see a similar recommendation on the Ricci Flow podcast.
Yeah, I think you can use it every day. Sort of 15 minutes a day is a sort of time that people have to spare. And maybe if you had a large panel, right, you could lie flat on the bed, lie on top of it. You could use it as a pillow put your head on to stimulate the brain.
And so there we go. There doesn't seem to be a lot of confusion or ambiguity with these specific recommendations that Dr. Hamblin is saying. That you just get a decent sized panel, you lay on it for 15 minutes, and there you go. You're doing clinical grade red light therapy as recommended by one of the world's leading researchers. And you probably also heard in these clips that you can do red light therapy once a day, even though we do know it's effective to do it every other day or just a couple times a week. So it depends on what you're trying to accomplish. And so Dr. Hamblin seems to be very confident that the current LED devices on the market can deliver therapeutic total joules of energy in a reasonable amount of time of 15 to 20 minutes. And you may even feel a little bit of incidental warmth, which you could cool off with a fan.
Pandemic conditions, you need a lot of energy. But with LEDs, you can do it. You don't even get that hot. A little fan maybe will keep you cool, but you don't get that hot.
But generally, there's no condition of an overdose as long as you're not overheating the skin or the body.
Nobody really knows if there's an upper limit. Because this is actually, so we're not doing any thermal damage. You might get a little warm, but you're not going to get any burns or anything. Nobody really knows if there's too much light energy. Probably not.
And it's a fun fact that you can absorb 1 million joules of energy just laying out in the sun for an hour.
So lay in the sun for like an hour at midday. Do you know how many joules of energy you'd absorb? Have a guess?
No.
1 million. 1 million joules of energy.
But he recommends about 50 to 100,000 joules of energy for a therapeutic dose of red light therapy.
But if you think 50,000 or 100,000 joules of energy on your body is something to aim at. With these whole body light beds, you can absorb 100,000 joules of energy relatively at 20 minutes sometimes, something like that.
And so that's why there's a huge margin of safety of what red light therapy delivers in terms of energy and intensity is often lower than what you even get from nature. And even what you're exposed to in nature doesn't cause any harm. And so that's why red light therapy is so extremely safe, that the effective doses are much lower than any threshold of causing overt harm. So if we want clinical grade red light therapy, as recommended by some of the leading researchers in the field, we use relatively low intensities for about 15 minutes. So that's it. I'm Andrew from Gemba Red, and thanks for tuning in.